Hi, I am Dr. Sanjay Pandey. Today I am here to answer your questions on various male sexual health issues. Pain during sex in men could occur because of various reasons. The common reasons what patients do approach a specialist for are tight skin or phimosis, where the prepuce or the outer lining skin could be too tight, which could be rubbed during mechanical friction and could cause trauma. And the trauma of pain and the trauma of difficulty in retraction could give a severe pain. That's something which is very common where men don't know about it. The other cause which we have been seeing more commonly in young men is Peyronie's disease, or a gradual curvature and acquired curvature which happens in the penis. This is an acquired condition. Men do suffer from this very silently, but they go through the agony of pain during erection and pain probably post-erection too. The third and probably one of the common causes could be infections happening in the external genitalia, more commonly on the tip, on the skin, and also on the urethra as a result of UTI. So urinary tract infection could be a cause which could lead to an infection. An infection would be just painful too much to perform sex. The three common causes of painful sexual dysfunction are actually treatable, and men need to know about it. So Peyronie's disease has got both medical as well as surgical treatment. It depends on when you see your specialist doctor on that. When it comes to infections need to be nipped in the bud. We need to understand that as men, we can have infections emanating from the tip of the penis, the prepuce, and the urinary infection in the urethra. All the three can be treated with antibiotics and with a specialist examining you and looking at that if anything else required in terms of prevention can be done altogether. The commonest cause of painful sexual dysfunction in men performing sexual activity to me is phimosis, which is the tight skin that doesn't retract well, and the retraction causes pain. The mechanical friction causes too much of pain. It can actually sometimes become an emergency. That is something which is treatable by a cosmetic and a functional procedure called circumcision. We do a circumcision where we remove the extra amount of skin and patients are treated and cured out of this problem. There happens to be request for circumcision for cosmetic reasons. All circumcisions that we perform are both for functional as well as a cosmetic purpose, but alone for cosmetic reasons to remove extra amount of skin which is pliable easily and where hygiene is being maintained is not mandatory. We also have acquired phimosis, or the skin gradually tightening up in life, and that's more common in diabetic individuals whose diabetic controls may be poor. So if there is a poor diabetic control, it can be picked up as the skin gradually tightening up and there is infection in that prepuce or the outer skin. Such patients may develop acquired tightness of phimosis, and they may complain that they're not able to pull their skin back, there's developing infection and painful sexual activity. So in all diabetic individuals, the hygiene demand is much higher because the infection can set in and it can tighten the skin, and therefore a painful sexual activity. Such patients deserve circumcision to benefit from a good cosmetic work. Circumcision is not a painful procedure to start with. It's done under local anesthesia or general anesthesia depending on the surgeon. At that point in time you anesthetize and the procedure is completed in a cosmetic and functional way. Post-surgery, there's a little heightened sensitivity because the glands or the tip of the penis is actually exposed. So there's always this myth that we are worried about. It could be very painful during and after surgery. During surgery, it's painless for sure. Post-operatively, you may have some heightened sensitivity, which your doctor knows how to decrease it down. Gradually, the effect gets blunted and you feel better. But that takes approximately a few days to a few weeks in individuals. So let me bust the myth that circumcision is a painful procedure. It's not. Circumcision is a surgery on a sensitive organ, and it's an external procedure, so everything is visible and felt by you. When we do a circumcision, we don't decrease the penile sensitivity at all. What actually happens is the glands or the tip is exposed. People feel a little extra sensitive on the first few days, which maybe go on to a week or two. Ideally, because there are small stitches which gradually dissolve, people are required to be maintaining hygiene, keeping it clean and letting it heal. As the healing process helps and improves completely, people are allowed to perform sexually after anything between a fortnight to a month. In between the healing process and your surgery, you've always seen your doctor again and ensure that things are fine and you've taken that advice. Yes, Circumcision has been proven scientifically that removal of that extra skin which was tight, which was preventing us from maintaining good hygiene, actually helps us in preventing infections. So we become more of self-hygiened individuals, and the risk of cancer or penile cancer, which is so common in uncircumcised men, goes down dramatically. So premature ejaculation is a male phenomenon. Almost everybody may have at some point of time premature ejaculation, which could be primarily to start with, or it may be a new onset after many years of sexual activity. Premature ejaculation could be something to start with, like the day I start bicycling, I may fall down for the first or second time, and I learn by practice and getting better and better. Same issue here, premature ejaculation is a lot of anxiety in the mind. Somebody suddenly finds that he was good when he was performing solo self-stimulation, but when he is with a new partner or new partners, he finds that he just cannot hold. He feels ashamed and let down because he's not able to perform the way he's expected to or he was capable of. That's not true. It requires a partner participation and therefore an understanding partner on the opposite side, because sex is always a conjugal phenomenon between two partners. So understanding is very important. Quelling the anxieties and myths amongst ourselves is a good idea. But finally, we need to see a proper specialist. It boosts our morale when somebody tells us that premature ejaculation is not permanent. It could be a primary phenomena. It could be a phenomena which could be settled and which could get treated as days go by. It comes by practice. So apart from getting confident that it can be treated, it's all about looking at getting calm, having a gradual foreplay, looking at medical management, which there are many. The specialist would advise you on various local anesthetic gels, various kind of relaxation exercises. It's all about learning it very gradually. There are medicines which help you in terms of a timed and learned behavior, where your whole interest to be able to hold ejaculate for longer time to help you and your partner to be able to come to a proper level, this all can be managed very well. Most young men have anxiety about safe sex, and in such situation, counseling is the way to go in our country, where a lot of knowledge is not there available on the public forum. Contraception or condoms are the way forward for young men, where they could be safe in sex because of exchange of fluids which will not happen between partners and therefore prevent infections in men. Unwanted pregnancy is always an anxiety when young men perform sexually, and it could be very safe for them to prevent unwanted pregnancy along with infections when they are using condoms. And finally, there's always this worry about pleasure and loss of pleasure with condoms, which is not true, because this could help us prevent premature ejaculation to some level when the sensitivity of the tip of the penis is brought down when you use a condom. So in other words, you could be able to satisfy yourself and your partner during sexual activity while you're being very safe. So this cuts down the anxiety to very high levels. Condoms are safe and they could help young men. Erectile dysfunction is a common couple phenomena where couples could be going through the agony of not being able to capably perform sex, which could be situational, which could be sometimes anxiety related or psychogenic, or a small subset of patients could have organic or disease related erectile dysfunction. It is important to dispel myths and quell their worries and anxieties, giving them a chance to improve themselves and encouraging them to perform, because with performance and practice comes success, and they could be successful on that. It should not lead to a situation where erectile dysfunction becomes a wall, becomes a loss of confidence between the partners, and should not be a tipping point waiting to happen for a long time. If that's what happens to couples around, it's nice to go to a specialist who deals with various aspects of sexual function and could help you out in terms of evaluating and probably helping you out in those discomfort levels that you have and taking you to a proper organized treatment, whether it's situational, whether it's psychogenic, or whether it's an organic dysfunction. Stress is a very common denominator and a cause for sexual or erectile dysfunction. We look at diabetes as being a very common epidemiological phenomenon right now. Diabetes and uncontrolled diabetes brings about a lot of change in the erectile processes of the organs, and erectile dysfunction almost becomes progressively and irreversible. Smoking, sadly, is a very common phenomenon in young men, and smoking brings about changes in the vasculature of the penis, which again brings about erectile dysfunction to very irreversible levels. So sadly, if you look at quality of life diseases, it's important for young individuals to change their lifestyle. They need to keep the diabetes under control, bring down their stress with various lifestyle changes, decrease their smoking and drinking habits. Not alone that doctor or a medical team or medicines would treat them. It is important that we ingrain lifestyle changes, improving our lifestyle, seeing the right doctor, doing our research, and then probably getting treated around. Drugs also are common causes of erectile dysfunctions. One of the common causes on medicines is antihypertensives, and if antihypertensives are keeping you well in terms of your blood pressure control but causing a severe degree of erectile dysfunction, it is good not to hesitate but speak to your doctor and talk about it to both your cardiologist and your andrologist, and bring about those substitutions which would help you reverse your erectile dysfunction. So vasectomy is a daycare procedure. You come in the morning and we take you into the operating room where, under local anesthesia or general anesthesia, the surgical team performs a no scalpel vasectomy where we don't make cuts in the scrotum. There's a hole created, we grasp the vas, we do a vasectomy, we ensure that we've done the right procedure, you recover well and possibly go back home or even go to work. That's the way it works. So in other words, there can be a mild sensitivity of the scrotum which takes few days to heal, where your doctor will give you anti-inflammatory and antibiotics. A week later you could see him and you almost healed. So this happens to be a permanent sterilization procedure which is almost painless during surgery and after surgery too. Vasectomy does not affect your orgasm or your erections. Vasectomy is a sterilization procedure where your volume of ejaculate may go down, but in no way does it cut down your ejaculation or your orgasm, so that there's no way you are dissatisfied with sex post vasectomy. Absolutely not. There's no buildup of spermatozoa or sperms in the testes. Body has an amazing computerized mechanism. It knows how to recycle the entire process around. Once a vasectomy is done, the body recycles the entire process around. So there's no way there is a buildup of sperms inside your testes for you to feel uncomfortable. So there was some anecdotal study long back which talked about correlating, not really causally, prostate cancer and vasectomy. That study has now been found not true. We don't find vasectomy in any way increasing the risk of prostate cancer in young men. Vasectomy is a permanent sterilization procedure. This is an understanding in the couple that we have decided to complete our family and therefore we'll undergo a sterilization procedure. The male sterilization procedure or vasectomy is a wonderful superficial procedure done under daycare with an excellent recovery and recovery times around, compared to the women who undergo tubectomy, which is a more extensive procedure. And sadly, more women undergo sterilization procedure than men in the world, even in India. I wish we could make more men understand and encourage them to undergo vasectomy as a sterilization procedure, because that does not in any way affect sexual function, that in no way affects the recovery and the conjugal relationship between them and the partner, while the women folk don't suffer from that. The 5 tips that I would be keen to give to men for healthy genitourinary tract starts with hygiene. I see many young men and many elderly men who would come but would not be taking hygienic care of their sexual organs and genitourinary organs. It is important that we maintain great hygiene by pulling back our prepuce, maintaining great health, washing and cleaning up with soap and water like we maintain our hygiene every day. Hydration is a very important aspect and the second important aspect of care for genitourinary organs, because either you are dehydrated because you drink less water, more of tea, coffee, cola, and secondly you would form stones. So dehydration is not acceptable because it could lead to urinary infections or stone formation. Thirdly, many young men are worried about their sexual activity and safe sex. I think barrier contraceptives, which is called condoms, is very safe for you to prevent yourself from unwanted pregnancy and urinary infection as a result of partnership. Fourthly, it is very important for us from this platform to inform young men that any kind of untoward happening in genitourinary tract which is visible to you, which could be number one, any kind of redness, any kind of progressive itching, white spots, any kind of growth which you examine yourself during your hygiene and find it, should not be taken with medicines off the counter. You must see a specialist, a urologist, an andrologist in time. That's very important for you and for your safety. And finally, as we all age as men, there are changes happening in genitourinary tract which we should accept. I may be the same individual, but my body is internally changing. And genitourinary tract undergoes various hormonal changes in men. What happens is the prostate undergoes an enlargement, Therefore, it occludes the urinary passage gradually. We would find as men in our 40s to 60s that our urinary flow gradually goes down. It takes a long time to empty the bladder, and we sometimes are not able to empty the bladder. The urinary bladder responds by contracting more frequently, and we'll end up with overactivity of the bladder and therefore passing urine more frequently. That's the age group I want to wake people up, because like women who undergo evaluation with their gynecologist for breast and for ovaries, it's important for men in their 40s to 60s who have got complaints or even no complaints, because there are changes happening internally and silently, to see their urologist, to be able to take this forward in terms of a urologist evaluating them with some evaluations, some examination, which could be as much as a prostatic examination. In that way, we will be safe enough and we'll be able to maintain our genitourinary tract to better levels and to safe levels which we seek. Finally, to come to an end, thank you so much for your queries, which brings about more and more question and answers between us. I'll be happy to take comments on what we have discussed today, and very happy to take more queries to dispel doubts and to help you to safeguard your genitourinary health. Thank you.